You got to figure out exactly where the patient's stuck, physically, mentally, emotionally. So I've always treated physically, mentally, emotionally. That's always been in my repertoire, because that's what I had to do. So you asked me the difference between allopathic medicine and like naturopath. Well, I look for the root cause. And the why I do that is because I love the lab companies I started getting into. Around the time I went to Belgium, I started saying, you know what? I like to do things backwards. I'm going to find out what the lab companies are going to measure, and they're going to find out how to figure out the pathology that way. So we've integrated their naturopathic medicine, we've integrated, the things I learned in Europe, we've integrated things I learned at Princeton Biocenter, so all along you just keep learning and your toolbox gets bigger and bigger. So we have too many treatments now. Sometimes you just have to figure out what to use that we can help so many people at all different budgets too. Before I practiced the meditation or anything like that, I was going down the functional medicine route like Atkins, but Atkins when I was much younger. Now this is like kind of bring it up to about 25 years old, and I needed a job because I knew I was burning out in the restaurant business. So I went to this place called the Princeton Biocenter in New Jersey. The Princeton Biocenter was started by Carl Pfeiffer. Now it's called the Pfeiffer Center. Pfeiffer died, unfortunately, but he would literally take mentally ill patients and get them on regimens of vitamins, minerals. He had very unique testing that nobody has. He's the only one that has tested for tourmalines and different imbalances in their brains. He was with Abraham Hoffer, literally the first doctors to ever do orthomolecular medicine. They're like the godfathers of what we do now. A lot of it. I mean, a lot of naturopaths also learned a lot from the German doctors who came over from Germany at the turn of the century. Father Kneipp was back a little bit farther, and there's Kellogg and a number of those. But the orthomolecular medicine using like different levels of minerals, vitamins, herbs to kind of just tweak the brain and change it, even if they were schizophrenic. I mean, really serious mental illness. And I saw those patients going back out to work as long as they kept taking their medicines. But they would take them for a while and feel like they were fine, and they would stop taking them and everything would come back. So they had to come in the office quite a bit. So I saw them there, and there was another place called Earth House, very near where I was working in Princeton. They did the diet, they cleaned out all the chemicals in the diet. It was all free range, all organic. I mean, we're talking like 25, 30 years ago, they were starting to do all that. And there were doctors like Dr. Newbrander I work with, who basically found out a mechanism for the autism. And he found out if you take a tiny little bit of methyl B12 and you do a little shot in these children, a lot of them will completely turn around and they won't be autistic anymore. Or they'll be on the autistic spectrum and they'll be very high functioning when they were like almost catatonic. And he has his own website. I mean, he's done this for years. Dr. Camo was there, Dr. Cruzy, Dr. Pfeiffer. Dr. Roberta Morgan, too. Actually, I just talked to her last night. I haven't talked to her for years. She's in Haddonfield in New Jersey now with a big anti-aging clinic. And we all started from this base. And I hadn't gone to school yet. I mean, I was in college. I hadn't gone to medical school. So I went there one day and I went to get to the doctor. I went to Dr. Newbrander and he did all these testing and everything, your blood pressure. And he says, well, you need to be all these supplements. It's like Atkins, but it was much more advanced. And so what happened was I had to keep going back to the pharmacy because I could only buy the little bottles because I didn't have much money. There was a guy behind the counter. They actually had a real pharmacist then in that day, and his name was Vince Brett. I'll never forget. It's like as clear as day. And Vince said to me, do you want a job? I'm like, well, I didn't do an interview. You don't even know me. How do you know? He goes, I bet you want a job. You need a job, right? So little by little, they could see this guy coming in. He has a really hard time in his life, and maybe I was interested. I asked a lot of questions about what they had there, and so whatever reason, it was just meant to be. I said, well, I don't know. I got to think about it. Well, I'm going to tell you, there's no way I could have ever gone back in the restaurant business at that time in my life. I wouldn't be here, literally. I'd just be so burned out. And so that was my ego talking. I'm going to think about it. Of course I needed a job. And then this is like the best place I could be because I could learn everything about my body and why I was sick without having to pay the doctor. So I did. I came back. Yes, I want a job. And the pay wasn't great and everything, but I got to work in the medicinary and I was packing up all the boxes. I had my own office in the garage. Like my own office, nobody bothered me. I had walls of vitamins around me, and they would give me all the orders from that. They would ship. We shipped a couple $1 million a year of vitamins out to their patients because their patients. This place was renowned. They came from all over New Jersey to get natural medicine. Even the Amish came there because the Amish don't want to do any chemicals, no drugs, and they would come to us with all their regalia and their robes and everything. And they would come whole families of Amish. I mean, I didn't see any carts outside, no horse carts, but they came in. And it was a great experience because, I was there for 5 years. It was amazing. And I worked my way up to manager of the pharmacy, the medicinary, we called it. I went to lectures, and anything that they had going on for the doctors, they would include all the staff. Like every staff member would get to go to lectures. Oh, I forgot to say, Dr. Jaffe was there. Russell Jaffe, who's pretty renowned now. He has his own vitamin line. And these guys are MD PhDs. They're very bright, and so they figured out a lot of ways to do things that kind of the average research, average doctors really wouldn't be doing it that way. And they're very bright people. So I learned that for 5 years. I learned why I had high blood pressure, more or less. I couldn't completely control it yet, but I was getting there. And that was kind of a stepping stone. But at the same time, I was going back to Rutgers. So at Rutgers, I met a lot of really cool people. So let's speed it up. So that's like the beginning of my learning a lot about medicine, even though I don't have a degree yet. These guys are very renowned in their fields. So later on, about 10 years ago, I'd been working in naturopathic medicine for a while. I was getting kind of bored. And so my mom saw that, I guess, and she said, well, what's the matter? I was like, well, I'm getting kind of burned out. Doing the herbs and the homeopathics in West LA is really hard because those guys, they just want to do what they want. They don't really want to listen to you too much. They just want to climb the ladder and get into Hollywood. People are tough to treat. Great people, but they're not so easy to treat because they have a very stressful lifestyle. Hollywood, I don't know what it does to people, but it stresses them out big time, so they're hard to treat. So I realized I needed more than just, homeopathics and herbal medicine. And I didn't know how to do IVs yet, and I did some B12 shots, but the companies really didn't have a lot of injections at that point. There were no peptides, there were no stem cells. I mean, we didn't have, to me now, we had nothing. But, so I would help them get in shape, but it was hard. So basically my mom said, what do you want to do? I was like, I don't know, I want to go learn something else. She goes, okay, anything you want, and you take 2 or 3 trips, you need all these credits, it was getting towards the end of the year, I'll pay for your trip, whatever. So they were so nice, so she sent me, and I got to go to Belgium. Because when I lived in Finland with my family, I went back to France and Switzerland for different summers. So I had friends there, I love Europe so much. And so I went to Belgium, and I worked with a guy named Hertog, Thierry Hertog. Thierry's brilliant. This guy's like the #1 hormone doctor in the world. He's done so many studies. He's done all the research. So I went there, and there was a class for 4 days, and I took it. And it was just so enlightening to me because the Europeans are doing things a lot differently than we are here. There's a lot of things you can't do in America they do in Europe. It's different. I mean, there's a lot of politics in medicine, unfortunately. I think everybody knows that. So when I went there, I just learned a lot more about like homeopathic injections and a lot of different research, like looking at diabetes differently, looking at a lot of different illnesses differently. And I had another like 12 things in my toolbox to come back. Well, that just started off the ball rolling. So now I'm a professional student again. I don't even want to work. I just want to keep going to school. So then I went to A4M, the Anti-Aging Society, and they're the largest in the country for anti-aging medicine. And at first I'm like, anti-aging? Why do I want to do that? That sounds like something, well, you give them some medicine, they feel a little better for a couple of weeks and it just goes away. No, completely false. It is its own designation of medicine. It really is looking at all the mechanisms in the body to keep your telomeres longer. It looks at deep genetics issues. It looks at everything possible to help you stay beautiful and inside and outside for as long as possible. And it really works. And what I saw from the anti-aging medicine, not only does it work for that, but you could take those treatments and you can move them into pathology realm. So when I'm treating my patients for really serious sicknesses, I started borrowing those medicines from anti-aging and putting them in that. Then I started borrowing what Hertog told me in Europe. Then I started formulating my own systems. And this is about 8 years ago. And then we had the advent of peptides, and I knew a guy, I still know a guy, really amazing doctor, Dr. Holtorf. He's in El Segundo, another brilliant guy, and I kind of got put with him. Somebody introduced me to him. He helped me so much, and we worked together for a while. And then, so he had the peptides. He was like a guru in peptides. And peptides are short chains of amino acids that mimic usually a constituent or some natural chemical in the body, but they do a lot more than that. So they're not drugs, they're not herbals. They're kind of in the middle, below drugs and above herbals and homeopathics. They're stronger than the herbals and the homeopathics, different, but they're not, no side effects as drugs. So it's a perfect medicine. And so I learned those, and then we got into the stem cells, and then I had some great mentors in that. I work with just pretty much 2 companies now with stem cells, and we started doing like facials and hair restoration and joint injections and using the cord blood, all placental. Okay, I want to make sure everybody understands this, that this is not fetal tissue. That is illegal. I think that, well, I don't want to get into it, but there's some companies in America that are not doing things correctly. And anyway, so we're only allowed to use the cord blood from the placenta because that's neutral. It's because it's between the baby and the mom. And there's different components of that. And we have a whole list of the growth factors, cytokines, and peptides that the stem cells are making. As well, we use exosomes, and we use something called Wharton's jelly. So I pretty much amniotic fluid. It depends on budget, and it also depends on what the treatment we want to do. So we're doing facials with that. We mix with PRP. We're also using ozone in there. We make the special mix between 10 cc syringes with ozone, B complex, PRP, and then we'll put other things in there, mix it together, and that's what we're used for our needling, our micro needling on the face or the hair. It works amazingly well. So we've integrated their naturopathic medicine, we've integrated, the things I learned in Europe, we've integrated things I learned at Princeton Biocenter, so all along you just keep learning and your toolbox gets bigger and bigger. So we have too many treatments now. Sometimes you just have to figure out what to use that we can help so many people at all different budgets too. I guess when I first started, or when a lot of naturopaths first start, we feel like we're not capable. I mean, any new doctor is going to feel like you just don't know what's going to work. And so you're not sure what to prescribe. And I think naturopaths especially are kind of fearful of going out into medicine because you have this giant world of orthodox allopathic medicine, Western medicine, and all these drugs. And those guys, they seem like so professional. They know exactly what to do at every single moment. And we didn't have, like some of our training, they go through rounds and rounds in hospitals. We don't get that. So they get their hands dirty. They get more surgery than we do and more drugs. But we would get more natural and more holistic treatment. And we get hydrotherapy in the beginning, which is a treatment. But I think the big problem with allopathic medicine, which I want to preface this, I have a lot of MD friends, DO friends. I mean, I have no problem with MDs or DOs. They're great. They're very astute diagnosticians, even sometimes better than we are because of the training that they have. But they do things differently. So they're taught in their school to diagnose the symptoms to they want to get a diagnosis, but then they're taught to use a drug for that diagnosis. So it's like one symptom or one pathology, one drug. But to my way of thinking, what we learn in the human body is way more complicated than that. And also, this is the art of medicine and the science of medicine. So there's two different components in medicine. And art, to me, is kind of the energetic side or the intuitive side of a doctor where you can sit and listen to somebody without having any thoughts in your head and you're just there for them. I mean, how many doctors are there like that? Even in the beginning, I had a hard time doing this, and I had to learn it to do homeopathy, because if you don't do that, you can't do homeopathy, because you've got to figure out exactly where the patient's stuck, physically, mentally, emotionally. So I've always treated physically, mentally, emotionally. That's always been in my repertoire, because that's what I had to do. That's exactly what I went through, so that's always going to be there. Some patients don't want it. They don't want to answer questions like that. They're like, am I under sometimes it's not a psych evaluation, but some of the questions are bordering on mental emotional symptoms, and I believe a lot of that can feed into the physical. So that's the only reason why I ask them. I'm not a psychologist. I don't profess to be. I don't want to do that. But for homeopathy, to be a good homeopath, which I still do a lot of times, if the case lends itself to homeopathy, I need to find out when you have some physical problem and it's preceded by a mental emotional thinking, and you do that in every area, like I'm going to Wisconsin, I do it there. Then I go to my parents in Texas, and then I come home to my wife here. They're completely different geographic places, but you're doing the exact same thing. And you're interfering with yourself somehow by your thinking, or a physical problem that comes up, or panic attacks. And I'm not saying this is all in the mind. By no way is it in the mind. A lot of times it could be just neurotransmitters literally in the body. Now, is a neurotransmitter saying it's in your mind? No, because it's not like you're thinking so much. But it is, the neurotransmitters can affect your thinking. So it can get complicated, but it's just very well-rounded. So I try to look at every dynamic of the patient and find out what they want to do. Obviously, that's the first. And then maybe I could lend more to that, to look for the root cause. So you asked me the difference between allopathic medicine and like naturopath. Well, I look for the root cause. And the why I do that is because I love the lab companies I started getting into. Around the time I went to Belgium, I started saying, you know what? I like to do things backwards. I'm going to find out what the lab companies are going to measure, and they're going to find out how to figure out the pathology that way. Because they were bright, and the lab companies were usually the PhDs who invented the labs. So they had to know everything about the pathology to be able to find out what you want to elucidate to find out what's wrong with the person. And we're talking about hair, urine analysis, hair analysis for heavy metals or other things, urine for heavy metals, for thyroid, or not thyroid so much, but for hormones, other hormones besides the thyroid. Thyroid's blood. Then you have saliva, you have stool. You have genetics now, DNA. There's so many companies coming up with the genetics. I think that's still kind of in its infancy, and I've worked with some really good companies. But when I'm a physician and you're spending money with me, I don't want to just order something that's going to show me all your okay, here's a lab that shows me you have 87 different SNPs, and these are all contributing. Well, how are they contributing to your health? You make it so complicated, you can't treat it. So when I do labs, I'm doing a lab that could treat. It has to give me some basis, some information that I know I can use it and treat with some medicine that's going to work. So that was a time in my life when I got into a lot of labs, and I got in, there's great lab companies out there. And I guess I resonate more with the PhDs than I do with the other doctors, but there's some good MDs too. There's some really good MDs.